Hello viewers, welcome to our Facebook live session. Today we have with us our specialist, Dr. Jayalakshmi TK, consultant pulmonologist at Apollo Hospitals, Navi, Mumbai. She comes with over 22 years of experience in this field. Today we'll be discussing about sleep apnea. Dear viewers, if you have any question related to this topic, please drop your questions in the comment box and we'll address it to Dr. Jayalakshmi. Thank you. Doctor, the first question is, what is sleep apnea and what are the causes of sleep apnea? Can you explain?
So thank you for having me here and for this presentation on sleep apnea. So sleep apnea is basically a more common condition than what people think, and it usually there is a associated with snoring, and there is a block in the breathing at night when the person is sleeping. This block is usually because of some obstruction at the throat level and usually caused because of fat deposition in the throat area in obese patients, but there can be other reasons as well. This drop can lead to fall in the oxygen saturation levels, this drop in breathing at night, and lead to the other consequences of sleep apnea which we can discuss.
So doctor, what is obstructive sleep apnea?
So obstructive sleep apnea is, like I said, when we are sleeping, the muscle tone of our body reduces. So automatically there is a relaxation of the throat muscles. In obese patients or patients with say some fluid retention around the throat area, the throat diameter reduces significantly when the person is sleeping. Because of that, the air is not able to flow through the throat into the lungs. Because of that, there can be reduced oxygen. First, if there is only a mild obstruction, there will be only snoring, but oxygen levels will be fine, person is still breathing well. But if this obstruction is more, then the airflow is so much reduced that the oxygen level also starts dropping. This is called as an obstructive sleep apnea.
So what are the causes of sleep apnea?
So the causes of sleep apnea is most common cause is obesity, where there is fat deposition around the throat area and a broad, thicker neck, causing a reduction in the airflow. The other common causes are you can have a fluid retention around the throat area, often in patients with heart disease or kidney disease. Sometimes there can be an anatomical problem, that is, there is the neck is too thick or it is very short in some people, or the jaw is little behind in some people, so that can cause, or the tongue may be a bit thicker, or the uvula can be little thick. So these anatomical problems can also cause a sleep apnea.
So doctor, how do we test if one is suffering from sleep apnea?
So basically the testing is done for 2-3 things. One is to test whether there is obstruction at the throat level, which is measured by the snoring sound and the sound during breathing. Then the chest movements are measured and the oxygen saturation is measured, whether there is a drop in the oxygen saturation at night. Also the sleep patterns are measured to see whether the patient is having enough deep sleep or whether it is more of shallow sleep. This is done by doing the EEG or electroencephalogram. So all these together are done in a test which is called as a sleep study, where the patient is monitored overnight. There are probes attached for the sleep, for eye movement, for chest wall movement, for snoring, for oxygen level. So all this gives an idea of complete how the heart rate is, how much the saturation was, how much the airflow was, how much snoring was there, how much of time patient has spent sleeping at night, and how much of it was deep sleep. We get all this information from a complete sleep study. So this is called as a sleep study.
So doctor, can a sleep study be done at home also?
Yeah. So as I said, there are so many parameters which can be studied in sleep study. So we can also study only the respiratory parameters. So in patients who are obese or only obstructive sleep apnea is suspected strongly, we can only do a respiratory study where the chest movements, airflow, the oxygen saturation is only measured. So this is called as a limited respiratory study. The EEG is not measured in these patients. So this is sufficient for many of the patients with severe obstructive sleep apnea, where we just want an indication of whether sleep apnea is present or not, how much oxygen saturation dip was there, how severe it is, and to be followed later on by a titration study where you are putting a CPAP machine and then checking whether it has improved. So this limited sleep study can be safely done at home in many cases.
Can sleep apnea cause hypertension or vice versa?
So sleep apnea can cause a variety of illnesses or worsen existing illnesses. So it can worsen diabetes, it can worsen heart disease, it can cause hypertension, it can cause kidney disease or worsen already pre-existing kidney disease. So it can cause strokes in some patients because sleep apneic patients will have more thicker blood, they will have a higher hemoglobin concentration. So this can cause a worsening of stroke. It can cause thrombosis episodes like infarcts in the body. It can trigger heart attacks. So it can cause a various number of illnesses if it is left untreated.
What can happen if sleep apnea goes untreated?
So as I mentioned just now, it can worsen a host of diseases in the patient. Also, it can have, the main effect it has is on sleep, because the person is not able to get enough of deep sleep. When your body is in deep sleep, there is more relaxation and there is more of obstruction. So this can lead to complete choking and lack of oxygen to the brain. This immediately sends signal to the brain, causing the patient to wake up. So this is a micro arousal, means the patient is not aware that they are waking up multiple times in the night. But when we see the sleep study, there are multiple small waking up, mini arousal we call it. So this causes absence of deep sleep. So the person is just not able to go into the deep sleep stage. So the person ends up feeling tired, sleepy, develops a morning headache, and worsens the obesity, eating patterns, stress, everything. So the patient goes into a vicious cycle where because of sleep apnea, there is a reduced energy level, there is more stress, less focus, less concentration, everything leading to more eating and more obesity, less exertion, physical exertion. So this is one of the main visible effects of untreated sleep apnea, and of course all the other effects on hypertension, diabetes, etc., which I mentioned.
We come to the last question. What is a CPAP machine and how does it work?
So sleep apnea is one of the illnesses where the treatment is not by drugs. It is by a physical machine which is called as a CPAP or a BiPAP machine. All this machine does, it's a very small portable machine which the person can use with the help of a mask. You may have seen these masks. They can be only a nasal mask, or they can be an oronasal mask, or they can be a full face mask. So usually we give either a nasal or an oronasal mask. So what this machine does, when you switch on the machine, it pumps air at a positive pressure through the mask into the lungs, through the throat. So this serves the purpose of keeping the airway open so that the patient is able to continuously sleep through the night. That recurrent blocking of the airway which happens at night in sleep apneic patients does not happen because of the CPAP. There is another equipment called as a BiPAP. They are very similar. The only difference is that a BiPAP gives a different pressure during breathing in and a different pressure during breathing out, whereas the CPAP gives a continuous pressure. So your doctor will prescribe which is a better machine for you based on the sleep study report, your symptoms, your convenience, which is more convenient for your use, and also based on something called as a titration study, which is a sleep study only but done with a CPAP mask.
Thank you, doctor, for joining this session.
Thank you so much, Louise.